Vabysmo is a pharmaceutical product containing the active substance Vabysmide. Vabysmide is a potent vasodilator that works by relaxing blood vessels, thereby increasing blood flow and reducing strain on the heart. Vabysmo is indicated for the treatment of hypertension, high blood pressure, and angina, chest pain. Indications: Vabysmo injection is indicated for the following conditions: hypertension, high blood pressure, angina, chest pain caused by reduced blood flow to the heart. How to use: Vabysmo injection should only be administered by a qualified healthcare professional. The recommended dosage and infusion rate may vary depending on the patient's individual medical condition. The general guidelines for administration are as follows. Dosage: the recommended initial dose is typically 2.5 to 5 mg, administered intravenously over a period of 5 minutes. The dosage can be adjusted based on the patient's response and medical condition. Infusion rate: the injection should be administered slowly over the course of 5 minutes to reduce the risk of adverse reactions. In some cases, the infusion rate may need to be adjusted according to the patient's tolerance. Contraindications: Vabysmo injection is contraindicated in the following cases: non-hypersensitivity to Vabysmide or any of the excipients in the formulation, severe hypertension, very low blood pressure, cardiogenic shock, a condition where the heart is unable to pump enough blood to meet the body's needs, patients with a history of serious arrhythmias, abnormal heart rhythms, patients who have recently suffered a heart attack. Special instructions: Vabysmo injection should be administered under medical supervision in a clinical setting. Patients with a history of liver or kidney disease may require dosage adjustments. Regular monitoring of blood pressure, heart rate, and cardiac function is essential during Vabysmo treatment. Patients should be advised to report any unusual or severe side effects to their healthcare provider. Side effects: common side effects of Vabysmo injection may include flushing or warmth in the face and neck, headache, dizziness, nausea, palpitations, awareness of heartbeats, hypertension, low blood pressure. Serious side effects are rare but may include severe allergic reactions, rapid or irregular heartbeat, chest pain, shortness of breath, fainting.